Hello, everybody. I'd like to introduce today's podcast. It's a very interesting topic and pertinent to many individuals, particularly, obviously, our undergraduate university students and our medical students. The topic of the podcast is going to be a bit unusual, and it's going to be to address common misperceptions and myths concerning not only getting into medical school, but once accepted into medical school, being a medical student. I think it's going to be of interest, etc. Before we formally start and introduce the members of the podcast today, I'd like to also thank sincerely the Southern Medical Association and the Southern Medical Journal for giving us the opportunity, the expertise, and providing the technical support and the venue and to have podcasts such as these. This is actually the second podcast in what might potentially even be a series as we venture forward. We had one previously on just connecting medical students and undergraduate students, and that really came from the conception and the planning and the implementation of an organization called MedConnect at the University of South Carolina and the University of South Carolina School of Medicine. So what I'd like to do is I'd first like to have Logan introduce himself. Tell us just a little bit about MedConnect before we get into myths and misconceptions, but also then more importantly, have everybody introduce themselves and tell us a little bit of each of you about your journey's path, what led you to medical school in the first place, and how you chose this particular path. But before we do that, Logan, would you introduce yourself? Tell us a little bit about MedConnect, and then would you then help me and help all of us introduce the panel today for the podcast?
Hey, happy to be here with you again, Dr. DiPette and Ms. Price. So MedConnect is an organization dedicated to, networking, connecting medical students with pre-medical students. Right now, we're based completely out of the University of South Carolina. And our whole goal is to just shed light on the application process and what life as a medical student looks like. And because it's a very, very nerve-wracking time to be a pre-medical student. So we're just trying to help those kids get through and get to where we are today, because we had people that helped us get to where we are today when we were in their shoes. And that ties perfectly in hand with the topic of our episode today. We just want to help again shed light on the whole process. So we just want to introduce some myths, if you will, that we kind of heard when we were pre-medical students that may or may not have been true now that we're here. So today with us we have the entire, we just handed over the organization MedConnect, but we are the previous executive team. We're all just wrapped up our second year of medical school, so we all have some experience and perspective to share on the preclinical years of what medical school looks like.
Logan, before we introduce the group, what led to your interest in medical school and the journey? And again, I'm preferencing this because I'd like to have each of us answer that just very briefly as well.
Yeah, of course. So I am kind of got born into a healthcare family. I come from a line of nurses. So I remember growing up and just walking into the ICU where my mom worked. So I've always just been exposed to the healthcare environment, the hospital environment. So I always knew I kind of wanted to do something in this field, and then loved science growing up, the stereotypical science and help people answer, but it's true. And then I got into University of South Carolina and joined AED, Alpha Epsilon Delta, that further reinforced my love for medicine. And then took a couple gap years. I worked in the ER during that time, and that really just drove the nail into the board. Knew what I wanted to do. I was like, this is where I want to be. Like, I love this environment. I love the teamwork with it. And I just knew it's where I wanted to be.
Well, thank you, Logan. Go ahead and why don't you introduce the executive team and the group today that's going to contribute to our podcast.
Yeah, so we'll start off. I'll hand off the reins to Rebecca Stoltz. She was our vice president, and I'll let her go ahead and introduce herself.
Hi, nice to see you all this morning. My journey into medicine was kind of similar to Logan's. I had a lot of kind of different practitioners in the family, whether it be physicians, NPs, PTs, nurses. And I didn't really know what they did. I just knew that everybody worked really hard and they had different job titles. But I started shadowing physicians in high school through a program that my high school did and just fell in love with it. So I'm happy it all worked out in the end.
Timothy, do you want to go ahead, introduce yourself, and maybe just tell us a little bit about you and again your journey?
Yeah, definitely. Hey everyone, I'm Tim. With our great group before us for Rising M3, so we get to start our clinical years of medical school in these next couple weeks, so we're getting excited for that. But my journey in medicine, I didn't really have no one in my family was involved in healthcare, but similar to Logan and Becca, just always had a very strong curiosity and like fondness for science and just loved learning its applications. And then in fifth grade, we read the book Gifted Hands by Ben Carson. And I just really loved the way he portrayed being able to be a physician and able to give back in his community and just have such a positive impact on people's lives and allowing them to return to daily activities. And that's just it really just got a hold of me and ran with that and wanted to pursue a career as a physician from very early on, and then just had multiple experiences in high school with some friends' dads who are physicians who let us come in and shadow and just kind of further solidified that this is what I wanted to do with my life.
Well, that's wonderful, Jeff. Oh, sorry, Allyson.
Hi everyone. Thanks so much for having me. It's so good to see y'all this morning. So I kind of had a similar path to medicine that the three people previously just spoke on. I was very interested in science, math, and I kind of always just had this feeling that I wanted to work in medicine. And throughout high school and undergrad, I just had these kind of like little moments, personal moments, where they just reinforced that that's what I wanted to do. And that's what I did. So thanks for having me.
Well, thank you, Allyson. And Jeff, go ahead and then bring up obviously the group.
I thank y'all for having me. Not to beat a dead horse, but pretty similar to the group before me. I come from a medical background, and I've just always really enjoyed working with people growing up and doing volunteering work in high school and undergrad. And after I finished undergraduate at USC, I took several gap years working in the ICU to save up a little bit of money for a wedding and to get some clinical experience before starting med school. And now that I'm here, I've been loving every second of it.
Well, thanks very, very much, Jeff. I've already heard some links, I think, to some myths and misconceptions. I've heard individuals coming from medical and or health backgrounds, et cetera, and then others not. So I think that's going to be something we're going to explore. Let's go ahead and jump right in. Let's break this kind up into maybe perhaps two categories. One, let's start with our undergraduates and their issues, concerns. Obviously, all of you recently lived that and successfully navigated that journey. So let's talk about some myths regarding applying to medical school, perhaps the application process, what you have to do or who you have to be. And again, some of you have already kind of like touched on it with life experiences. One of the myths that I have heard, or at least one of the concerns that I've heard, especially from our undergraduates, of course, is do you have to have specific experiences? Some term it as, do you have to check every box, on an application or every box of life, or can you be more diverse, et cetera, in your journey, your personal experiences, your family background, et cetera? Let's start with that, and I guess that would allude to, does every pre-medical student or aspiring student have to fit a certain pattern and just fit this really narrow pathway and walk that pathway? In terms of those regards, it's extraordinarily common thought and concern of our undergraduate students. I bet not only at University of South Carolina, but other institutions as well. Anybody want to take that one on? And let's just jump in and talk about that a little bit.
I can lead us off. And Jeff, you can have them edit this out if you don't want it said. But before we get too deep, I'd like to shout out Jeff is a new father, and I just want to say congratulations to him. So if he mumbles a little bit or stutters a little bit, he's very tired right now. Just to give him some grace. But
Congratulations, Jeff.
Hey, thank you so much.
so yeah. So does every pre-medical student need to follow the same exact path or check every box to achieve their goal of getting into med school? Um, so I remember when I was a pre-medical student, like it very much so feels like you're running this rat race of like, I have to do this and that. And like to some extent it's true. But at the end of the day, I think the most important thing is that you find things that you genuinely enjoy doing and stick to those things. Because even if you do check all these boxes, like, you know, you get some research experience, some clinical experience, some volunteer work, your highest science GPAs, all that, all those boxes that you have to check, you have to talk about that stuff in an interview. And I feel like, you know, a good interviewer will be able to pick up on like, you're just doing something to do it compared to you're doing something because you actually enjoy being there. Like you enjoy being part of a research team. You enjoy being at the clinic, talking to patients every day. Um, so it's just much easier to show your passion for medicine if you find experiences that you want to do. And I think that's the most important thing to keep in mind.
Thoughts from other members of the group?
Yeah,
Yeah,
I would agree with what Logan said. I feel like if somebody comes in with like 800 research projects, that's super awesome. But if they can tell if you were just doing it to check the box, and if you can't sit and talk passionately about it, it's not going to look as amazing as maybe one research project that you poured your heart and soul into. But another thing I wanted to touch on is clinical experience. And though it's not technically required, I feel like it's really important because, especially during interviews and even just going into this field, you kind of want to know what you're getting yourself into. And without clinical experience, it's a little bit hard to communicate to the admission staff why you would be a good fit in medicine when you don't really have any experience in it.
Wow, that's actually really good advice, Jeff. I'm gonna turn to you because you're still awake as the new
Yeah.
dad. Well, I've got you.
Yes, sir.
What do you think about this? Because it really is a common concern, and I'd like to put it in the myth category, but I don't want to do that without really an in-depth discussion for our undergraduate audience.
Yeah, absolutely. I mean, when I was on the applicant perspective, it certainly felt like, oh my gosh, I have to do 1,000 things, and it's already too late for me to fix my mistakes in undergrad. But really, after communicating with other people, once I got to med school, you really realize pretty fast how different everyone's backstory is. I remember my first day of class, the person next to me, a classmate of mine, she is a like 30 mid 30s year old woman with 2 children and just decided to go back to med school, and then the other person to the left of me is fresh out of undergrad. So I mean, it really, we all end up in the same place whether you start at one point or another, and it's a lot more important to find what you like and do it, because whenever it's time for interviews and they want you to actually talk about it, they can see if you have some passion behind your eyes and what you really want to do versus just checking every little thing.
Allyson, agree, disagree, myth or reality?
So I would agree that there is some truth to needing some clinical background, needing maybe experience on a research project at some point. But I will say that during my interview, they asked me about my art. I talked about my passion for art and how I kind of incorporated my interest in medicine into my artwork. And they did not really touch on the research, the clinical experience, the volunteering much at all. And so I think it's important to essentially have some kind of experience in those areas so that they can see that you do know what you're getting yourself into. You don't know what it takes to be part of a research team. But my biggest piece of advice would be to not forget about kind of what everyone else is saying, the things that make you special, the things that make you you, because that's really what they're going to show interest in when they're looking to admit you to their program. So try not to neglect that. And if anything, try to seek out those experiences even more than the research, the clinical experience, the volunteering, the shadowing, because that's really where I felt like I excelled in my interview personally, was being able to talk specifically on that interest. So.
Well, Allyson, thank you. But you've also touched on another topic that's closely related when you mentioned art and your interest in that area, which is obviously very, very exciting and impressive. But again, myth or fact that certain majors or certain areas of study or study concentrations are better or lend better to the journey to be accepted, et cetera, or not. And I'm going to stay with you, Allyson, since you kind of led into this with your mentioning, obviously your experiences with art and then how it translated to the interview.
Yeah, I'm gonna say myth for that one. I'm just
Yes.
gonna flat out say that's a myth. I know many different people in medical school in my class and classes above me who have majored. I know somebody who did music in undergrad. I know some people who were English majors. So I would say that's a myth. They do obviously require you to take the classes that are required by most medical schools in the United States to get to apply in general, but I don't think they are particular about your major at all.
And any of the others, advice obviously the most common major and path is science or biomedical science or public health but obviously it's a myth that you have to be in that niche. Advice then to undergraduates that are coming from a different direction or a different perspective. Rebecca or Tim, chime in.
Yeah, so I would say I was a biochemistry major, and those classes, I think it was nice because kind of the prereqs for medical school were built into my schedule. But the classes I loved and I wish I took more of were like the weird kind of like out there ones, because you have your whole life to study medicine and science if you go into this career. But I mean, I took a class on Russian fairy tales, and that was a really cool opportunity that I probably won't have the chance to do again. So my advice would to like try and sign up for those classes that are a little bit more out there, a little bit more fun. Because just being a lifelong learner, it doesn't hurt to kind of expand your horizons and get into some cool stuff.
Jeff or Tim, if you are coming from a different line of study, et cetera, should an undergraduate be prepared to talk about it and feel proud of it and or incorporate it into their story?
I think a little bit. So I was a psychology major, which is not like, like biochemistry or biology where it's like usually like 1, 2 that applicants for medical school come in majoring in, but it's a little farther down the list. But I remember I got a lot of questions, especially applying after the COVID pandemic and stuff like that about how my time as a psychology major had kind of opened up my mind to different struggles with mental health and stuff like that. So I got to talk a lot about that, and that was pretty interesting to talk about. And then when I was picking my major, I was just thinking about what interests me the most. And coming out of high school, I'd taken AP psychology my senior year and just had a great experience with that. And was honestly leaning towards psychiatry going into medical school because I thought it was very interesting from my experience in that. So I just followed my passion with that. And when I was applying to a college and trying to pick my major and just followed my passion with that, and then just knew that I could tag on like a biological sciences minor behind it or something like that to get those other prereqs as well.
Logan, since I take it the consensus of the group is that's a myth. Do you have any advice or to undergraduates that are listening that are coming from a different, obviously they've taken the science and the prerequisites that are required for the application, but they really are coming from a different tact, a different world, a different journey.
Yeah, I think you touched on it a minute ago. You kind of have to embrace that. Um, you shouldn't feel at a disadvantage or like an outlier. Because at the end of the day, just to even be allowed to apply to medical school, you have to cover those prereqs and take the same exact
Yes.
MCAT exam that everyone else takes. So your score means the same thing as theirs. Doesn't matter if you're a different major. Um, and then, like Tim said, you picked that major for a reason. You didn't just fall into a random major. So you probably picked it because you loved it, and that means something. Allison touched on this earlier. Like they want to know what kind of person you are when you get to medical school, when you get to your interviews. So that's your major is a big part of who you are. You're not just, again, not going to randomly fall into that music major. Like our friend who took music in undergrad took it because they have a genuine passion for it, and that keeps them well-rounded as a person. So you should just embrace that and know that you're on equal footing, if not greater footing than, the typical path.
Great advice, Logan, and all of you, thanks. This is again kind of like temporally or kind of related to the tack we're taking and the discussion that we're following. Another concern or thought I hear from our undergraduates, particularly, and by the way, I just addressed the Alpha Epsilon Delta group. I was honored to present to them as well as our Tri Beta science group, and this came up. These are real questions or real concerns, and the question that I was stumped a little bit initially, and then I kind of like got my feet again. But was, do you have to know somebody to get accepted into medical school? Do you have to? I mean, several of you do come from health backgrounds, and then that's good, etc. But is that an absolute? Anyone chime in?
I'll keep
I'd
the
like
ball
to say
rolling.
no. Oh, sorry, Logan, didn't mean to cut you off. I'd like to say no. I mean, it certainly wouldn't hurt you to know someone,
Doesn't
but at
Mhm.
least for me in undergrad, I wasn't a very social butterfly. I didn't join like a pre-med fraternity and
Mhm.
get involved in a lot of like the Columbia kind of networking opportunities. And I still ended up okay. I wouldn't say it hurts you to know someone, but you can certainly get by without it.
Well, we're going to say you're okay, Jeff. We'll give you some validation there. Others, thoughts. Do you have to know somebody? Again, do you have to be connected to an institution, either by family or legacy, or just because you've been in that community and that town, like even USC? Does that help, hurt, or doesn't matter?
So my take on this is you don't need to, but it makes the application process a little bit less confusing. I think a lot of the help, especially with like mentorship and what we try to do with MedConnect and AED, is just to kind of lay things out, even things as simple as the timeline of applying. If you've never seen somebody do it before, or you've never heard about what you're supposed to do and when you're supposed to do it, it can be super, super daunting, scary, confusing. So I think a lot of the benefit of quote unquote knowing someone is just getting that advice of like, these are the things you should be doing. This is the timeline you should be working with, like maybe even giving you a guesstimate of how many schools or which schools you should be applying to. So it's definitely not a requirement to know someone to get in, but having a mentor definitely helps make the process less daunting.
So what you've alluded to is that the complexity of the application process, it's not easy. Matter of fact, I think it's incredibly daunting. Again, I'm of the age where we did this in paper and pencil, but actually, believe it or not, that made it easier, I think, because there was only so much they could ask you to do, in my day. So I'm going to say I had it easy, even though you had to fill out every one of those applications, by hand. But again, for the undergraduates here, how does an organization or who do they turn to? I mean, I know we have MedConnect, and I think that's just an incredible value or that our undergraduate students have. But organizations or universities that don't have a MedConnect that bridges undergraduates and medical students together, how do undergraduate students do this? How did
I
you
think
guys do it?
to find a mentor, you just have to take that first step and ask somebody. It's very daunting and intimidating. Um, I know you kind of sometimes have like that imposter syndrome of like, oh, they don't want to mentor me, but like you'll never know until you ask, and you'd be surprised how many people are willing to take someone under their wing because it's very fulfilling. Um, when I worked in the ER for my 2 gap years, there were multiple doctors that I turned to when I was applying to med school, like, hey, do you have advice on this or that? Um, and I'd even ask them like personal questions, like, like how was balancing a social life and the stuff that we're going to address today? Like I was reaching out to doctors about that to know what to expect when med school came. But it all started with me going to them and just saying like, hey, do you have a few minutes to talk to me today? Or can I get your number? And I think that's very important. So to come back to the question, you don't have to know somebody that's like institutionalized. You don't have to know someone in the network you're applying to, but you should try to find a mentor just to lay out the process for you and ease all your concerns and help guide you in the right direction.
Logan, some of our undergraduates, I mean, it's kind of like scary to approach a professor or I know I was petrified of my professors, even though I should not have been, because they turned out to be the most wonderful people. Once I got to know some of them. So how does that undergraduate student take that first step?
Well, I know when we met you, Dr. DiPette, you were giving us a lecture on hypertension because you're the
Yes.
king of hypertension. And I was like, oh, Dr. DiPette's lecturing. That's our MedConnect mentor. Like we need to go talk to him after class. And I think we're all just kind of gathered around like a bunch of nervous ducklings waiting on you to finish your lecture, trying to catch you at the end. I think we quite literally chased you down.
Yeah.
Um, so that's just what you have to do. If you know you want to meet someone, just got to make that first step towards them and just, if you're scared, like embrace it. You're going to be nervous. It's not easy. They can say no, but that's the worst thing that could happen is they say no and then you go ask someone else.
Yeah, thanks, Logan, and thanks for the plug. I mean, I hope I didn't do any harm. Right? We tell everybody first do no harm. So please let me know if I did any harm. Let's turn now and cross that bridge, if you will. Although we want to make it a very small, little, easy bridge to cross between undergraduates and medical students. Before we talk specifically about some myths about medical school and being in medical school, you mentioned already, Logan, work-life balance, et cetera. How do you compare and contrast the challenges of being a pre-medical student, and then all of a sudden one day you walk into to a new environment called medical school environment with all kinds of new challenges and fears and anxieties and obviously fun and enjoyment. Anybody try that one. Yeah.
I can start us
Okay,
off
well
with
then,
that.
okay, Becca, then you're on. You just beat me to Allyson. Becca saved you.
So I think one of the biggest differences in undergraduate versus medical school is when you're an undergrad, especially pre-med, you feel like you're constantly trying to prove yourself and you're trying to kind of show these schools why you're a great student and why they should accept you. But the nice thing is once you're into medical school, the whole staff just wants you to succeed. And so I felt a lot more supported when I got to medical school. It was like, okay, these people want to see me do well. They want to help me make connections. Like if you tell a mentor your goals, they're going to do everything they can to make that happen. And it's a really nice feeling.
Wonderful. Tim, thoughts on your transition from undergraduate to medical school? We could focus on challenges, but also rewards. I mean, Becca already said some of the positive differences between the environments.
Yeah, definitely. I was gonna touch on what Becca said a little bit too, like definitely the pre-medical, being a pre-medical student, you feel like you're in competition with a lot of people a lot of time, trying to get your name ahead of theirs because you're trying to get into these schools that a lot of people are applying at. And that's a difficult challenge to balance. And then contrasting that with medical school, our school is fantastic. I feel like we're all on the same team, all on the same side. We share a lot of resources, really just come together and try to push each other to be the best we can be every single day. And you create a culture just that, you know, kind of forces the best out of people here in medical school. And I really think that's one of the a stark contrast between undergraduate being a pre-medical student, being a medical student now. And then just some other challenges, I guess, now that we have a medical school we might not have had as a pre-medical student is part of the challenge for me was I came straight from college into medical school. And so it was kind of hard to like leave some behind some of the college student life of just always being able to interact with friends and hang out all the time. Whereas where you go to medical school and like this is your job, because this is all there is to do really, is to try to chase the best grades we can and be the best medical students we can so we can chase the dreams of applying to the certain specialties we have. So it's a bit of a transition. That was a little difficult for me at first, kind of transitioning from college life to life as a medical student.
Wow. Allyson, anything else to add?
Yeah, I can definitely touch on some of the challenges. So with all of what's already been said, this overwhelming support that you receive in medical school definitely makes the tough times a little bit easier. But I will say the transition from maybe studying for 2 or 3 days before a big test in undergrad or studying the night before, cramming as we call it, that doesn't exist anymore. You study pretty much all day, every day. And I remember the first 2 weeks looking at one of my friends and being like, this is really how it's going to be. This is what we're going to have to do every day. And we kind of laughed and we're like, yeah, we're just going to make the most of it. But this is our life now. And it really is your 9 to 5 is study. It's not, when people say that and we were just kind of like, oh, they're probably just trying to scare us. It's not, it's really not going to be like that. It is. But you adapt and then everybody is kind of in that same mindset of like, this is life. This is what we have to do to get to where we want to go. And we all just support each other while we're doing it. So it's not as bad as it sounds. But it is true that you do study pretty much all day, Monday to
Also,
Friday.
let me embellish that from my end. I'll even give you my own personal perspective because this was seared into me. Obviously, it was like traumatizing. For me, I came from a very small school, Seton Hall University in New Jersey, and then went to Penn State School of Medicine. And the day I transitioned from and moved in to medical school at Seton Hall, I was not the top, but I was kind of one of the better students. I was well known. I was engaged in all kinds of organizations. Again, in a smaller environment. And then I went to medical school, and that first week, I was just one of everybody. I mean, everybody was better. I thought, at least, everybody was better than I was, and I can't do this. And what happened, to this new environment, and how am I going to manage that environment? And I want to tell you, it scared me. I got very, very anxious that first 4, 6 weeks until I realized, wait a minute, we're all in this. We're kind of all in this together. But thoughts on that? Did anybody else have that feeling? Because I certainly did.
Yeah, I'd be happy to touch on that. Like, I remember after my 2 gap years, like when I got into med school, I was like, oh my God, I got into med school. And then a couple hours later, it was like, oh my God, I got into med school. It's about to get really hard. And at least from my personal experience, I was afraid going in. I had been a couple years out of undergrad and starting back into a much harder academic curriculum, that it would be kind of more of like a negative experience adjusting back to it. But I found those gap years for me to be beneficial because I got a lot more adjusted to treating every day like a work day after a couple years being in the workforce of, okay, I'll outline my schedule. This is how I'm going to break apart the whole week, and can treat it a lot more like a job. It's cliche, but it's how you do it. Um, it's like one of the bigger differences from undergrad to med school is you can't be as spontaneous as you used to be. I don't have a lot of spontaneous fun days anymore. It's a lot more planned out, but really once you get used to getting your hands dirty and finding your new rhythm, it has some tough days to it, but I feel like it helps you adjust.
Thanks very, very much. And that actually leads us right in to another section or another thought process. And again, myth or fact, and that is, and it's already been mentioned, work-life balance. I've already heard how much work medical school is. I've even heard the word job. That's incredible. And I have to study every day. I just can't study for the test. So I've taken all that in from the group, but then, with all that said and done, the thought out there is that you can't have a work-life balance. Tim, you're a new dad. I mean, I guess we should turn to you first. But nevertheless, myth, fact, can you still squeeze in personal life, family, friends, marriage, children. We heard about an older medical student with two children. How does that work?
Well, at least for the beginning, it felt very overwhelming. For our curriculum, we start with anatomy, and it felt, for me, so far in the didactic years, that's been the hardest time to find the balance between, we had mandatory lectures for the entire semester, and on your own time, you go to the anatomy lab, even when you're not dissecting. But really, once we saw the light at the end of the tunnel through anatomy, and I enjoyed anatomy a lot, but once you get to where you're more so just balancing lectures and study time, I found it easier to plan out dates and go have fun with your friends on a Saturday. You just work a little bit harder on Thursday instead, where you just checks and balances, having a crappy day to have a great Saturday. And it's after anatomy, I felt like it's really smoothed out after that.
Other thoughts? And then I'm going to also start asking, I'm going to ask you, how did you attempt and or try or even succeed in maintaining, good mental health, good physical health?
Yeah, so I think a lot of it comes down to setting your priorities. And especially like Jeff was saying at the beginning of school, I would get so caught up in studying. You always feel like you're behind. And the first things I would cut out would be working out and doing anything that resembles free time. And then I felt at the end of the day, I just didn't feel good about spending the day studying like hour after hour. And you do still have to study every day. But once I started incorporating working out, hanging out with my friends, my grades stayed the same, or maybe even got a little bit better, but I felt so much better. And so I think it's really easy to just say, oh, I don't have time for that, I have to study. Like, oh, I can't see my friends today because I have to study. But it helps your mental health and sometimes even your test performance if you make time for those things, because they do really make you feel good.
Becca, let me stick with you then, since that was heartfelt. Did you lose any hobbies, or did they disappear, or did you gain new hobbies,
I gained new
maybe in
hobbies.
collection with other students, etc.? How did that work out?
So I actually did gain some new hobbies,
Mhm.
and it was entirely from the influence of my friends. Allyson and my other friend in our class made me start running because
Oh,
I love working out, but I hated running. And then one of our friends decided she wanted to do the Disney Marathon.
Mhm.
And when I found out you're allowed to go on the rides during it, I was hooked. So we'll be doing that in 2027. But running's a big one. I also got into reading for pleasure again, which is really nice. Sometimes that kind of falls off the handle, but whenever I can get back into it, it's really fun. So yes, it's possible to A, keep your hobbies, and B, get new ones.
Allyson, since you were already mentioned here, chime in.
Yeah, I absolutely felt like work-life balance is attainable. That's a myth. I have probably been able to do some of the most, I guess, had the most fun while in medical school. Um, so it's definitely possible. I stuck with running, got some friends into it. I've been trying out like other workout classes. Becca and I actually are part of another organization called Healthy Strides, and we partner with like local fitness studios and we do Pilates, cycling, yoga. And so we got to do that, which is also a great stress reliever and a great like brain break from studying. So that's definitely possible. I picked up embroidery. Um, I felt like that was just it's a very fun, like mindless thing to do while maybe winding down before bed or watching TV or something like that. What else? I'm like, yeah, I picked up plenty of new hobbies. I really like to cook, and I still at least meal prep like a good meal on Sundays before the week, but cook dinner for myself, like a good meal probably 3 nights a week too. Um, so yeah, I think it's definitely possible to stick to your old hobbies, pick up new ones. Went to almost every football game on Saturdays.
Oh,
So that's also possible. And kind of what was touched on earlier, if you just put a little bit more planning and thought into your schedule and you say, okay, well, I'm going to go to the football game on Saturday, so I really need to have a good day on Friday. It's possible.
So now I know who to ask how to find a parking space for the football games on Saturdays, Allison.
I think
be
Logan
prepared
might
for
be the one to
email.
ask for that.
What, Becca?
I think Logan might know the parking situation better than me and Allison.
Well, then, Logan, you watch out for that email because fall is coming up. How about sports? Did any of you have, not only maybe it could be competitive sports or just a real sport, a sport that you were really into, and then medical school comes along. Is that possible to continue, not continue, adapt?
I can lead that off. I was actually on a couple of our intramural teams this year. So because our school of medicine is still affiliated with, the main campus, University of South Carolina, we get to compete in those intramural leagues just like an undergrad student would. So I was on the soccer team and the basketball team the second semester. And at first, I was a little stressed out because it was spring semester, the semester that we took step one at the end of the semester. So I was like, is this smart? Like, there's other hobbies I'd like to continue. Like, am I sacrificing something here? Am I sacrificing study time that I might need? And then I went to my first basketball game and I was like, I only played like 10 minutes because I was the newest person of the team. I'm not taking anyone's spot or I'm just out there for fun. And I went home and I was like, oh, that was so much fun. I got home at like 10 p.m. and just went straight to bed, but I just felt so energized the next day. And like it was just so nice to break out and do something. And then I went to a soccer game. Same thing. I was like, oh my, it's like 8 p.m. Do I really want to go out here? And then just again had so much fun, revitalized the next day. And I think what med school's done for me is it's really made you learn to appreciate your free time. And when you put that time into planning it, and then you kind of it's the wrong mindset, but earn it for lack of a better word.
Yeah.
It's just really it makes you enjoy the moment even more when you have those days off, and it's because you planned accordingly, got all your work done. Even if you didn't get all your work done, it's a nice little break. So yeah, I had a really good experience playing those sports this semester.
Got it. Logan, you mentioned step one. And again, that leads me into this is completely different, different area, different part of the journey, the medical school journey. But many medical schools are going to pass fail. Step one clearly has gone pass fail nationwide. I hear pros and cons of that. And they possibly the pros and the cons can possibly be myths or realities on both sides. I've heard, well, with being pass fail, it hurts chances of getting into competitive residency programs, et cetera, or it makes that application more difficult. How do I stand out? Also on the plus side or the positive side, obviously it takes a lot of pressure off of one. The competitive edge may be improved. We can talk a little bit about competitiveness in medical school, perhaps next. But all of you, talk to me a little bit about that, particularly as it relates to our audience. Myths, facts regarding pass fail, whether it's medical school class pass fail and grades, and or even our national tests.
I would argue that that's a myth, that it's not dampening the work ethic, because with school, with our preclinical years being pass fail and step one being pass fail, it's kind of opened up the doors for a lot of us to pursue like other extracurricular activities like MedConnect here. We've been able to, donate a lot of our time towards mentoring the undergraduate pre-medical students at USC and be able to take part in podcasts like this and work on some other fun projects with MedConnect. So I would argue it hasn't, and it is honestly beneficial to students because it opens up the door for them to pursue other extracurricular activities that they love and kind of can give them more like a sense of, what's the word to kind of describe it? You can have more, I'm completely blanking, pause.
Tim, that's quite all right.
Completely blanked.
We made it a long time without our first pause. I'm proud
Yeah,
of
I'm
us.
telling you, this group is
minute.
these are veterans. You guys are veterans. Yeah. Other thoughts on that? Anybody got a contrarian opinion to that it could possibly make pass fail, whether it's step one and or grades, grading pass fail could make it more difficult.
I
I,
can speak on this. Oh, sorry. Do you want to
Go
go?
right ahead, Allison.
Okay, I
No,
was
I've
saying
been
I can
chatty.
speak on that a little bit. I don't think that the pass fail has dampened the work ethic at all. Um, I felt like I never once was like, oh, well, it's pass fail, so I'm not going to study as hard for this test. I still, even though we don't get number grades on our final transcripts, we see what we get on every exam. And as much as you're like, oh, well, it doesn't really matter my score, the number per se, it does like personally matter. You still kind of take what you get and you're like, okay, that's a good score, that's good for me, or that's not. So I honestly, I think that them still giving us the number of grades makes like it doesn't really have an impact on your work ethic. You're still working to achieve the best score that you can. It does feel good, however, if you don't do so well, to know that it's okay if you didn't do your best on one of those tests. But I don't think that that was a reason that people didn't try to study as hard. I do think it has made the emphasis for residency applications a lot more on everything else that you do. So as much as it does provide you the opportunity to explore other endeavors while you're in medical school, it also just kind of it feels like you're kind of also forced to do that a little bit because you're now on this even playing field again, and you're like, okay, well, you're back to square one. What can I do to set myself apart again? Which I think has pros and cons. I think that it's a great way to get involved in something that you may not have even thought to get involved in before if you had still had number grading. But then at the same time, I think that there's a lot of pressure around trying to find as many extracurriculars or trying to get involved in certain things as you can while you're also trying to balance the difficult studying schedule.
Let's kind of start to wrap up with something, going to go back to being more general, again, if you will. How would you describe the culture? Again, we're all one medical school, the University of South Carolina School of Medicine here in Columbia, but the culture of our medical school, perhaps you have other colleagues that are in differing other medical schools that you stayed in touch with and compare and contrast different cultures, or is it all very much the same?
So, oh, Jeff, you want to go ahead? Okay.
Right answer, Jeff.
So my response to this kind of ties into the previous question about being pass fail. And I think that with our school especially, there's already a really big sense of community. There's only 100 of us in every class, and we're paired with a mentor in the class above us and a mentee in the class below. So that really helps us like get mentors, foster relationships within our class and within the other classes. And I think a big part of that is because we're pass fail, we're not really in competition with each other. And because of that, people are constantly sharing resources, studying together. If somebody makes like a really cool study guide, they're sending it in the class group me so that everybody can use it. Or we had one girl in our class who would make practice questions for every topic that we covered, and she would send them into the group me just because she put in that work and she wanted other people to be able to use it too. So I can't speak for other schools, but at our school, there is a huge sense of like, we're all in this together. And if one of us has a win, everybody has a win.
Other thoughts on the culture of medical school, I guess, in general, but maybe even more personal too, obviously here in Columbia.
I feel like one other point I wanted to make, and it's more USC in particular, but it's not just the classmates that have such a strong culture together, but it's also all the faculty as well. Like for our first day of orientation, our first like our anatomy professor, she goes out of her way to make sure she knows everyone's names and something about you before you even get there. And it's been pretty much the same story from every semester since then. I have another professor that told me they were gonna bring me a box of diapers because they found out we had a baby. And we'll see professors in the hallway, and they'll know your name. They'll ask how you're doing. They'll check in on you, and they'll go out of their way to help you succeed if you need that extra help, which has gone a long way for me with the impression on the school.
Again, any thoughts on this topic, or let's even make it more general? Final thoughts as we come to the conclusion of our podcast today.
I think it's like, especially our school, like, we have such a great culture of everyone working together to be their best. But, medical students in general, they're very, driven individuals that want to be the best that they can be. And when you create a culture of where you put all those people like that in a room together, but the culture of the school is already established that we're working as a team, I think it just amplifies that effect and drives the students to be even better and the best that they can be as everyone just comes together to encourage each other. And I think what helps with that, especially at our school, our classes were mandatory our first semester. So you really get to learn who everyone is and really meet them and realize that these are your friends and y'all are going to be working together for the next 4 years. And it's just kind of exciting thinking about all that you'll be able to do together.
Well, with that, and thank you very much for the comment and the support. I want to thank all of you. Time is valuable. We've already talked about taking time and work-life balance, but even the balance of taking this time, not only to think about the podcast pre-podcast, but also to take the time to join all of us today, and again to join the Southern Medical Association and the Southern Medical Journal and that bigger family. I just want to just give a very, very, very big thank you. And I'm so proud of the group. I thought the discussion was lively. It was heartfelt. I think it was honest and sincere. We didn't sugarcoat. I didn't hear sugarcoating a lot of the topics just to sound good. So again, thank you, thank you, thank you. And again, a big thank you to Southern Medical Association, the Southern Medical Journal, and Ms. Price.
Please support our mission to improve quality of patient care through education. Join us, follow us, and share this content with family and friends.